I'm your moderator. My name is Adrienne Smith. I'm the president and CEO of the New Mexico Caregivers Coalition. And with me, I have, how about I say your name and you tell us a couple sentences about yourselves, please. Jeremy Maxand.
Thank you, Adrienne. Good morning, everybody. My name is Jeremy Maxand. I'm the executive director of the Living Independence Network Corporation, which is a center for independent living serving Southwest and Southern Idaho. We empower folks with disabilities to live as independently as they want in the community. I'm also board member of the Idaho Access Project and am on a number of different state and local committees related to accessibility and issues around access and disability.
Thank you, Jeremy. And with us too today, Rochelle Tierney. Rochelle?
Hi, I'm Rochelle Tierney. I am with the Idaho Council on Developmental Disabilities. And the Idaho Council on Developmental Disabilities advocates with and for people with developmental disabilities statewide. And most importantly, I am also a parent to a young adult with autism.
Also with us is Dana Gover. If I have that pronunciation correct, Dana, could you take yourself off mute and introduce yourself?
Thank you, Adrienne. Yes, my name is Dana Gover, and I own my own business. It's Access Concepts and Training. And then I do a lot of contracts. And one of the exciting contracts I do is a coalition called Northwest ADA Center, Idaho, where I provide technical assistance and training on the Americans with Disabilities Act, Section 504, fair housing, and many other things. I am also a person with a disability, and I have used personal assistance services where I have direct care workers that come in my own home to help me get up, live. They're basically a lifeline to my independence so I can enjoy life and work. And thank you.
Thank you, Dana. And the fourth panelist, Diana Willis.
Thank you. So I'm Diana Willis, and I work with Jeremy at Link currently as a project coordinator. And then also I am a board member of the Idaho Access Project. And I am a person who is blind, and I kind of gone through life losing eyesight over time. And so kind of figuring out how to navigate and work and live life fully. So thank you.
Thank you, Diana. We've got 3 objectives for this panel, and I'll share them with you now. We want to develop a shared responsibility for building the direct care community that we want to see within the state of Idaho. I say we because I feel part of you now. And the second objective is we want to learn about current data and also ask you to complete a barriers to services survey. We'll have some really great information recently announced on both of those fronts. And then the third really important objective that we'd like to accomplish this morning is we want you to feel empowered and eager and excited about taking personal action to improve the direct support professionals workforce by contacting state agency officials, legislators, whatever it might be, however you can do it. So to set the stage, I'm going to share with you a little something that was just released, I think last week, and then ask Jeremy to talk a little bit more about it. It was called the Living Well Project. And some data came out just last week that showed that 20,000 individuals with disabilities and older adults depend on in-home and community-based services in the state of Ohio. So since July 2020, though, 27 assisted living facilities in Idaho have voluntarily closed or surrendered their licenses or given notice to Medicaid residents, stating that they are unable to find workers as the #1 reason cited for these closures. And Jeremy, are there other things you'd like to add to our opening, our setting of the stage?
Yeah, thanks, Adrienne. The study that was conducted this last year, I think, is really informative, and it mirrors some of the data that we've seen nationally around who direct care workers are and the challenges that they face in that being a part of that workforce. And I think there's a lot of commonalities and things that we see in Idaho. We know a lot of direct care workers are lower income. They make less than $40,000 a year. A lot of them are sole providers for their families. Many care providers are folks that may be new to the United States, immigrants or new Americans. Oftentimes, particularly in other states around the country, we see a lot of caregivers are folks of color. And we see that this is a very fragile workforce that is not united necessarily. And we can talk a little bit more about that in the data. Is not a united front with a strong united voice advocating for more resources for direct care workers. So there's a lot of work to do, and there's a lot of pressure and stress and not a lot of resources for folks who do an incredibly important job in our state for tens of thousands of people who, as Dana mentioned, rely on those folks and the work that they do and the care they give to remain independent and free in their own communities. So I think what we saw in that data really mirrored what we've seen around the country, and I think paints a picture of a workforce that really needs a lot of support and investment because the job they do is really critical for so many people.
Thank you, Jeremy. So this conference today, it's for caregivers, also care recipients, also legislators, and I understand that there are many advocates from Idaho and even other states attending today. I'd like for each of our panelists maybe to talk about what's in it, in terms of, why do each of those types of stakeholders need to care about this issue? Who, Rochelle?
Yeah, I mean, I think it's important because we're all a community. And so it's important that legislators understand the issues because they're the ones that control the funding in the state. And they also control all of our laws and policies. And so I think they need to have a better understanding of this workforce. And as Jeremy had mentioned, it's really fragmented, and that's based a lot on the types of services and the people receiving those services. So it's really a broad range from those that are aging to people with significant disabilities, so it's all in there. It's pretty much everyone's encompassed in there, and we'll see people feeding through that. And so I think legislators hearing from a variety of people is really important. I can speak to the rest of that population, or I can let some of the other panelists as well, but coming from as a family member too, I mean, this workforce is really important as they're supporting a family member. And there's a lot of things that we need to be advocating for our family members that may not be able to verbally communicate that. So we're there to support them.
Thank you, Rochelle. Dana, could you add a little bit to what Jeremy and Rochelle have talked about? Why is it important to have not only everybody at this conference attending, but maybe especially people who aren't here attending? I mean, what is the problem with the direct care workforce in your state?
Well, I think in my opinion, what I've been working in this for many, many years. The reason I got into it was because the services affect me. So what I see though is people don't really understand that many of us that live in our own homes because of direct care workers and because of these programs, if these start collapsing, then people may go to nursing homes. However, people in nursing homes, even the staff in nursing homes, they cannot get staff. So we have a lot of people that would not be able to contribute to the community. The systems get so complex sometimes when they could be very simple. But it, it comes down from federal rules, regulations, and all kinds of things. But, over the years, my independence relies so much on the people that are willing to do the care. And if we don't all work together in the community to educate people, because a lot of people just don't understand how important direct care workers are. Because if you don't have a family member or you don't know anybody, then they just don't get it. But I think that's maybe some of the issues with the legislators.
It'd be interesting to know what some of the legislators, particularly because I understand, just like here in New Mexico, the issues pertaining to rural caregivers is such a magnified challenge. Maybe rural legislators know about that firsthand, about the problems of finding care in rural communities. Speaking of kind of barriers to services, Diana, I learned about and I could put these in the chat for you if you like. There's a barriers to services survey. Could you talk about that and the importance of people completing that while we're here today?
Absolutely. Thank you. Yes, back in November, Link launched the Barriers to Services project. And in early January, we made live an online questionnaire that you've provided the links for both in English and Spanish. It's a short questionnaire, really less than 10 questions. It's pretty quick. And what we're trying to collect through this survey is the specific challenges and issues that people are facing in Idaho statewide around the direct care workforce crisis. And so we're really wanting people individuals who have a disability, parents of children with disabilities, family members, friends, care workers, and service providers to take the time to complete the questionnaire. And, I think that goes back to we've been, fragmented as a community, and this project is really bringing us together. And so for some people who complete the survey, not all the questions will pertain to you, but what is really key for you to fill out is both your name and contact information, and then how you may want to get involved with the issue. And there are a few options to check off. If you're interested in writing to or talking to your elected official, sharing your story on social media or with the news media, or if you're interested in filing a complaint with the state of Idaho or an Olmstead complaint. And then the very last question is an open-ended question where you can write your specific issues that you think are important for us to know. We keep your information private and confidential. We won't share your personal identifying information unless you specifically give permission to do that. And it's a really exciting project. In just this short time, we have about 100 people who've completed the questionnaire.
Could you tell us more, Diane, about what you've learned already early on? I'm sure you're anxiously looking at the results yourself, right?
Yes. So last week, we launched our first advocacy action around the Barriers to Services project. And as of February 16th, we had 87 people who'd completed the questionnaire. And of the 87 folks, 62 or around 71% indicated that they wanted to contact their elected official. And I think that is really powerful. That not only people who are in the middle of a crisis right now have taken the time to complete this questionnaire, but they've said yes to taking action for legislative advocacy, which is so important right now. And even, so that's 62 people who said yes to talking to their elected official. But even those who, the other people, they indicated they want to take action in a different way. So almost everyone said yes to taking some type of action that I talked about. And of the 62 people who said yes to contacting their lawmaker, around 37% self-identified as having a disability. And then the other folks included parents of children with disabilities, family members, friends, caregivers, and service providers.
Thanks, Diana. We'll talk a little bit more about this survey again at the end. Are people able to take this survey, while we're in this conference? I just don't want to lose the opportunity.
Absolutely. Yes.
Okay, good. Okay, so you can do that either on the break, you can do it now. I don't think anyone will be opposed to you doing it while we're even in this session.
That'd be fantastic. And
okay,
when they click on the link, there is also contact information for me, either telephone or email. And people are welcome to reach out to me with further questions about the project and the questionnaire.
And we'll circle back to this toward the end of our panel discussion. Rochelle, Dana brought this up just a couple of minutes ago. Give us a picture here, since you provided this in the in the introduction that you got a family member. Give us a picture, a qualitative picture of the direct support professional workforce. What do you see are the pressures on this workforce? And then how does that affect your family member?
Yeah, I mean, I think generally overall for the workforce, there's a lot of challenges. They're highly underpaid. And part of that's due to, Medicaid reimbursement rates. But I think a bigger piece of it is really the undervaluing of the work. And it's looked at as a low skill type of job. And really individuals, they're working long hours. They don't have the right amount of training and specific training to individuals, but then also just really around person-centered thinking, trauma-informed care, just some really good grounding around the types of individuals that they'll be working with. And again, this is a broad scope. And so I think there needs to be a lot more time involved in that training. There's high turnover rates. There's, just around that undervaluing of the work, the lack of benefits. And so, there's competition for other types of jobs that may seem easier. So I think for the services that my son receives, he's on the developmental disabilities waiver, and not to bore people with all those types of funding, but we do the self-direct model. So he is able to, and with us supporting him as his family members, hire his own staff. And that is extremely difficult in this environment due to just the way that we can reimburse and we can pay for services when there's other companies that can offer a lot of those things. And in the self-direct model, we're the ones providing that type of training. So in a sense, it gives more power to the individual, but then it also lends a lot of other burdens to them. So,
and when you say a lot of, what are those other things besides pay?
So we're unable. So on the this specific waiver and how he's able to pay his staff, he's unable to provide a lot of those extra benefits. So that's huge. If they're sick, they need to take the day off. He's unable to pay based on the way that this waiver is set up. So Even things, if they got injured on the job, that would be solely on him. And then as his family members, we would have to help out.
And the flip side of that for the contracted worker who might be providing the care is that he or she doesn't get paid if they don't work.
Right.
So, yeah.
Yeah. So yeah, that's a huge barrier for someone looking at, oh, I want to provide this type of work. And in that specific waiver setting, there's those risks. Even working in a traditional, and again, I'm speaking directly to the developmental disabilities waiver. And if they're working for a traditional provider, a lot of those providers don't offer health benefits, as we've seen, and you can look through the study. There's a significant amount of individuals that are also receiving Medicaid that are providing work. So.
Mm-hmm. Our problem in New Mexico, I think, is partly due to the fact that some of those workers, even in the agencies, are contracted, when in fact they ought to be classified as employees, but instead they're hired as contracted workers. So,
yeah.
Dana, could you, what would you add to what Rochelle has to say in terms of, how the issues Rochelle brings up have made it difficult for you personally?
So ours are similar. I'm on the self-directed program under the A&D waiver, which is the aged and disabled waiver, which is quite a bit different. But we have a similar barriers. So to be under the A&D waiver, you have to go through an agency, and the state independent, or the CILS, the Centers for Independent Living, that Jeremy's the director, they have a self-directed program. So what that means is I can hire, fire, train my own personal assistants, and then Link is an FI, which is a fiscal intermediary, where they do all the paperwork, where they do the pay the paychecks, they do the workers' comp, unemployment stuff. But when I don't, I have like backup people, which is very, very difficult to find. But I can hire my friends. I don't have family in Idaho, so I can't hire my family, but I can hire my friends and their friends. And I've been doing this for so long now, I'm even hiring their kids that are now adults. But there's no, the reason they stay in this, and they've told me this, is because they care about me, because we're very close. I've had people that have worked for me for over 15 years. That's not heard. That's very, very not heard of unless you're a family member. I'm on the program because I work, and I'm on Medicaid for Workers, which is another program, but you have to be 64 and under to be able to qualify for that. And if not, you have to spend down your money. So a lot of people that are older that have, an income over maybe $1,200, they have to spend down close to $600 just to be on the waiver to qualify for that. But my personal assistants, they don't have sick leave, health care. Many are, the three that I have are on Medicaid, and thank goodness for Medicaid expansion, because that's how they access that. Many of my personal assistants that I've known over the years have family, children. So it was a great opportunity for them to work with me. And I always would allow them to bring their kids to work with them. A lot of places don't, traditional agencies won't, but I can pretty much control my own, the way I see my services. The one thing that I can't do is define a wage. The reimbursement rates back in 2011, they were higher than they are now to the agencies. So it's just amazing to me how people just don't understand how important this program is.
Thank you, Dana. Jeremy, in terms of accessibility, kind of complexity and all the things that you've seen, you've worked in a lot of different settings, environments, and even other states. But I know you're from the nonprofit sector, but you've worked in a lot of different kinds of organizations and agencies. What could you add, to the question about the challenges, the workforce, the workforce severity question that Rochelle and Dana have talked about.
Yeah, I would actually go back to kind of hearing what other folks have said to the importance of people engaging on this topic right now, because we hear a lot of lip service, and I don't want to disparage the legislature, but we hear a lot of lip service coming out of the legislature about freedom and liberty and independence. And every one of those legislators took an oath to the Constitution, and they took an oath to defending every Idahoan's life, liberty, and pursuit of happiness. And our job right now is to make sure that we're supporting people to let lawmakers know about their particular need to ensure their own lives, liberty, and pursuit of happiness. And that looks different for all kinds of different people across the state. And for more than 20,000 Idahoans, their life, liberty, and pursuit of happiness is absolutely dependent on these home and community-based services and these programs. And these lawmakers really need to understand that not only do they have an obligation and a responsibility to making sure we're fiscally sound in this state, and these programs, out of any program that our state government does, these programs save money and they support freedom. And they don't seem to be connecting the dots there. They have an obligation to making sure they're good stewards of dollars, which these programs absolutely ensure, but they also have a moral obligation to making sure that individuals are treated with respect and have all the resources and the access they need to programs to actually realize the values that we uphold in this state. And right now there is a misalignment of values and a misalignment of how we're allocating and investing resources. And the only way that's going to change is if actual family members and folks with disabilities and advocates and agencies that provide services are all on the same page, letting these lawmakers know that they may talk about freedom and independence in this state, but the only real way to realize that in Idaho is to get serious about investing in these services and these programs and making sure that this workforce is the strongest workforce in this state. That's the bottom line. And until we really bring people together and galvanize a united voice on this front, we're going to really struggle. And, I hope that folks attending this conference complete that survey, that they check those boxes. We'll follow up with them as we followed up this past week with 60 different individuals and made calls. And Diana's, Diana's comment really rings true. I've been playing phone tag and changing my schedule for days just because I'm trying to fit in with parents who've got kids who are running around, trying to fill gaps in care, who are working extra jobs or, are sitting on a couch at 2 a.m, trying to do the work for their agency that they couldn't get done because they're out there doing care, providing care to people. Even in the face of all of that, individuals are still willing to get on the phone and make a call to a lawmaker, even though they are not really optimistic that they're going to get a call back or that it could change things. And I am going to remain optimistic. And I think that if we bring our voices together and we have a common goal and we persist, I think we can change this for the long term. But it's going to take a lot of work. It's going to take everybody who's attending this conference and people well beyond that. So that's kind of what I think I would say based on what other folks have said on this call or this Zoom. But we really need to unite and we really need to build political power so that we can change this in the state of Idaho and we can defend our life, liberty, and pursuit of happiness, because that's what we all really want for ourselves and our families.
Jeremy, talk about the take action now. This is a perfect time for that. And I'll put that up in the chat. Yeah,
March 9th is I believe March 9th. I hope I'm not misstating.
Yes.
We're essentially just inviting anyone who we didn't pick up through the barriers to services questionnaire out there, and we're broadcasting far and wide across the state, calling on people to join us on that day to learn kind of what's happening with this issue if they don't know, to learn a little bit about what we're asking lawmakers to do, which is to immediately support an increase in reimbursement rates, but then also to stand up an interim committee so we can really dig deep on this issue and learn more and find out what other states are doing so that we can do similar things. And that day of action will support people to make those phone calls, to set up meetings with lawmakers. Anybody with any experience level is willing to join that. And we've got folks ready to support anybody at any level of advocacy. So if you've never done this before, join us. We'll give you the space, the time, and the resources to learn how to do that. If you're an expert, come in, help us train other people, meet peers, meet other folks in the community you may not know who are impacted by this. That's how we're going to get this done, is by building community and building political power. And so you can find more information about this through the link in the chat, or you can go to linkidaho.org, or you can contact Diana or Dana or myself or even Michelle, and we'll get you hooked up. But it's really important that we all are pushing in the same direction right now.
Thanks, Jeremy. This wasn't on our set of notes to talk about today. I want to ask the panelists to tell the audience here, are you worried about a future lawsuit that folks with disabilities and people who are elderly might bring against the state? Is there any talk of that? Have you ever talked about that?
I think we've talked a lot about access and the potential for that. There's currently a lawsuit in Medicaid around budgets and how budgets are allocated. And, but that's very, very specific to the adult DD program, so the developmental disabilities program. But as that's been rolling out in this issue, especially with direct support crisis, we haven't really brought that up, as a direct action, but, it could lead into that potentially, because as we were talking about some of those challenges, as people start to lose their independence and their freedoms because they're placed in a higher level of care. So we know individuals that have lived independently and are now moving into assisted living. And a number of assisted living agencies have closed. So in the report, we talk about 27 assisted living facilities throughout the state have closed. And so it's difficult for people to even find that. So, there's really, it's really getting to that point where this is really serious. I speak to individuals that want to, family is aging, is unable to take care of the individual and want to look into residential habilitation. So supported living or a certified family home. And there just aren't enough providers. And I think, we don't want anything drastic or dire to happen to individuals, but once those things do start happening, I think there could be that potential, and it would be unfortunate.
This is Dana. I'd like to start really briefly. So to live in the community, to have a disability, it's a civil right to choose where you live. And that's under the ADA. Unfortunately, the Medicaid federal rules, doesn't give a person a right to live in the community. They're just opposite. But am I afraid of a lawsuit? No, I'm not afraid of a lawsuit. And why am I not afraid of a lawsuit? Because we have the right. It's our civil right to be able to live in the community and file a complaint with the Department of Justice under Olmstead. I would hate to see that, but we have been working on this issue for so many years. We don't even have an Olmstead plan in this state. So, we really need to understand the barriers to community-based living. And we need to have our partners at the state level, and we've got some really good partners in Medicaid. But we need to understand this is our life, liberty, and pursuit of happiness, just like Jeremy said. And it is our right to file complaints, and it is our right to speak up. That's what civil rights is about. Jeremy, do you have anything else to add about that?
I think you nailed it, Dana. I don't think we should be afraid of a lawsuit. I think every tactic and strategy should be on the table at this point. And sometimes, during the legislative session this past year, we had to file a legal complaint against the leadership of the legislature because they would not take measures to ensure the digital platforms, which everyone was kind of, left to use because of the pandemic. They would not ensure that those platforms were accessible for folks who are blind or low vision. And we had to literally have lawyers file a complaint and threaten legal action to get them to do something about that. And that's just a website. We're talking about an entire program and millions of dollars. And so I don't want to do that, but I think at the end of the day, if that's what has to get done to change this, then that's what we have to do.
Other panelists? Opinions, ideas on that?
This is Diana. I'll just add that in reviewing the people who responded to the questionnaire to this point, there are quite a few who have said, yes, I'm interested in learning more about filing a complaint with the state of Idaho or an Olmstead complaint. And so that may not be the first action that people want to be able to, have to take, but people are willing to do it because people are in such a desperate situation just to be able to stay living independently in the community and really, and not to overstate it, but to stay alive.
Right. To stay
And remember,
alive.
this is a state legislature that allocates millions of dollars to defend legislation that they know is unconstitutional. They take our tax dollars, put it in a fund, and then use it to defend laws they try and pass that they know are unconstitutional. So that should put things into perspective and context for us, like what kind of an uphill battle this is going to be.
Yeah, I agree, because it's really around those priorities. And I think, just the value, the undervaluing of this type of work, but what does it really speak to overall as far as how we value individuals with disabilities in our state. And so we really need to all join together because there is value and we all deserve that. So
yeah. So let me go back to the workforce report, the Living Well report, and throw out, it was amazing when I just reviewed it quickly, how much the data there looked like the state of New Mexico. So 65% of all the respondents, and I think it was 277 individuals who responded. So that, that's not small, it's not huge. 65% of all respondents indicated their entire household made less than $40,000 a year, which is below the median household in Idaho. 51% of those respondents said that they were the sole income provider for their households. That's something that we see too. Whether or not that's a single mother or mother of young children. And in our state, that might be a woman who's caring for children as well as older adults in the household. I did not see that question in your Living Well Project survey. 67% of direct care workers who were surveyed in the Living Well Project said they made under $11 an hour. That is indeed the same number. Ours was $10.92 was the median. So I know that's poverty level. And the living wage in Idaho for a single person with no children is $13.95 per hour. And most survey respondents said they were not receiving that living wage. And I get that, Medicaid reimbursement hasn't been what it was since what did the speaker say here just a few minutes? 2008,
2011, I think.
2011, 2011. And still, I think that what Jeremy talked about in terms of pushing legislators on this issue, the federal government included, whether Build Back Better is that answer, I do not know, because one of the struggles that we have is, or conversations that we have continually in New Mexico is, will the workers actually see the funding that goes directly to providers? So, but I asked without putting you all in a hard spot, I don't want you to feel like you're in a hard spot, but would any of my panelists like to talk about that issue? About
I
wages?
can.
Go ahead, please.
So if you get your services through the Center for Independent Living, definitely. And I can't speak on traditional agencies on the A&D waiver, but we are a collective group of organizations and people with disabilities. CILs are made up of people with disabilities and run the programs. And so, yes, we all work together. There's 3 of us. There's LINC, there's DAC, Disability Action Center Northwest over in Northern Idaho, and LIFE. And they all 3 have the self-directed programs. And yes, they've made a very, they've dedicated to providing income, higher income to our personal assistants for our direct care workers. Jeremy, you want to add, since you're a director of LINC?
Yeah, no, I think that's right. Our singular focus, it seems at this point, is to figure out how to do that. And you can only squeeze so much blood out of a rock. I mean, and right now, we're having to, have conversations internally about how do we go find other external resources to make sure that every dime is going towards paying direct care workers. But again, I just, there's a general, like Rochelle said, undervaluing of people who have disabilities or are older adults. We just don't value us. Essentially, I've got a disability. I use a manual wheelchair and have for about 30 years. And we're just not valued the same way that an able-bodied middle-aged worker is in this society. And we have been, as an example, we have for 9 months been attending weekly meetings with the state about emergency funding to go to direct care workers. And it's an emergency. Like, where are our congressional delegates? Why aren't they pounding down the door of the Center for Medicaid and Medicare Services and ACL? And why isn't the state hammering the federal government? I mean, Idaho, of all states, should be hammering the federal government for taking almost a year to release emergency federal funding designed to help keep this workforce from collapsing. And our state has, we're going to be spending more money just on the bureaucracy of discussing releasing this funding for 9 months than we will actually getting funding out to community members. It's maddening. And I think it all kind of goes back to, we don't value people the same way we value corporations. And if this was emergency funding for big corporations, this would have been out the door in a heartbeat and with more to follow. And we're talking about a small amount of money in the big picture that's in the queue for 9 months, authorized by the state legislature from the federal government to go into the pockets of direct care workers. And all we do is attend a meeting every Wednesday at 4 o'clock to be told, well, CMS has more questions for us.
Well, and it's usually an 8-minute meeting too.
It's an 8-minute meeting.
No
and
updates.
This is unacceptable. And it's a reflection of how very little value is placed on the people who are receiving these services. And, I work with these folks. They're my people all day long. And they're the brightest, the hardest working, the most grit filled, the most resilient, tenacious people I could possibly ever be around and work with. And they contribute so much to the community, yet still the state undervalues everyone like this. And it manifests in all of these, even in these emergency measures, which should have been released 9 months ago. Anyway, I'm not going to go off on that anymore.
Right. And I
But-
think I want to kind of pull a contrast even into just this funding too. So you have the providers or the businesses and their funding stream. And then when you get into, again, I'm going to talk about the developmental disabilities only and self-direct. So these are the individuals with disabilities that are directing their own services, are not getting the equitable treatment that even the providers and agencies are getting. So they're going to be able to get the funding for all the services they've billed in a traditional or a provider model, and they're going to be able to utilize those funds for staff retention, recruitment, and incentives. Where then you have the individual, the person with the disability. And again, I can't state it enough about how do we value people with disabilities. So they're managing their own services, and they don't have access to this money. Their direct care, their community support workers and support brokers do, but that's only if they're currently working for them. So it doesn't allow them the same type of incentive to do any kind of hiring bonus, to do any kind of recruitment at all. So it's just going to go to the person. Maybe they have one person, maybe they don't even have a person working. That money's not going to help the individual. It's going to help providers, it's going to help businesses, and I don't want to. That's good. I mean, and we need that. But again, when it gets back to the actual, person with a disability, it's not impacting it in that same way. So anyway.
It's hard to follow Jeremy and Rochelle, but I'd like Dana and Diana. Do you have things you would like to add to that?
This is Diana. I would just end with the ask for everyone here today to complete the Barriers to Services questionnaire. Reach out to me with any questions or concerns or how you may want to get involved, and then spread the link to your community, and let's get this done and work together.
And this is Dana, and I'd like to add the same thing. Medicaid does not collect information like this that we're getting from the survey. They don't collect access barriers. So basically that's what we're doing for them. So your voice counts. And I'm looking at some of the chats and some of your stories that you guys are telling on this. You need to fill out the survey and get people to fill out the survey. Even if you don't think you should be filling out the survey, fill out the survey, because you would be amazed at some of the stories we're hearing across the state. It's heartbreaking. It's heartbreaking. These people are working their butts off. So I just want to thank all of you guys for attending, and we probably want to leave a few minutes for questions. So I'm going to shut up, but thank you. Yeah.
Yeah, thank you, Dana. We've got about 10 more minutes for the panelists before we go to questions. There is one thing I did want to pull out from the chat, because I know the panelists will have opinions and statements about this. There's a woman who writes, the max I can bill at an hourly rate of six hours per day, but in reality, my work is 24 hours a day. Any one of the panelists, I can see Rochelle nodding. What's the reality of the situation? And maybe speak to the importance of respite care or just the direct support workforce when you need somebody and you cannot do this another hour.
Yeah, I mean, I've been watching those comments too, and certified family homes are always overlooked, and they add such a value to the services in Idaho, and they're always the last ones. I noticed earlier up in the comments around rate increases. We're talking about those, again, around providers, and we're talking about brick and mortar providers that are that provide certain services, but these are homes, and the level of care that goes into certified family homes, individuals are, you know, at an institutional level of care. So the cost savings, you know, hundreds of dollars a day in comparison to an institution to $53 a day, and the amount of support and care is just always overwhelming. And I just think, you know, having that backup and that respite is really hard, and it really you know, to ensure that you have individuals there, it is a very difficult role to fill as well. And I think it puts a strain on families and providers, as well as your, you know, your mental health and your physical health. And it just impacts a lot more people than just the individual. They're probably not getting the best care that they can. And that's not against anybody. I mean, even as a parent, we're exhausted. And so, you know, people are missing out on a lot of opportunities to continue to build and grow. So I don't think
Jeremy, would you add to that?
No, Rochelle, I think, is in the best spot to speak to it. I
Yeah.
agree with what she said.
Thank you. I'm going to put this, the barriers to survey in there. I hope maybe Diana can see in real time. Do you have at least 18 new surveys since we started this panel? Wouldn't that be fantastic?
That would be fantastic. I'll have to check the Google form to know that. But
Okay. And then another thing, because we want to be sure you guys have plenty to do between now and March 9th, I'm also going to put in the chat the Take Action Now link, so you can be sure to sign up for that and be a part of it. Why don't we move, we're a little bit early, but why don't we move into Q&A? Everyone who wants, just take turns and take yourself off mute if you'd like to participate. And I'll try to look at the chat once again and see if there are comments that we've missed along the way.
Adrian, this is Sarah Taves.
Yes.
Could you share with us some of your learnings from New Mexico? My sense is that you are further along than where we are in terms of supporting the development and of direct care workforce.
I don't know if that's true. I don't know that we have, and I wonder, Sarah, if you're asking the question about what I asked the panelists in terms of a lawsuit.
No, not in terms of lawsuit, just
okay.
some of the programming that I think New Mexico has really tried to make available to individuals for training and supports for direct care workforce.
Okay, yeah, and I will talk about this at lunchtime in a lot of detail, but I think when we went out and in 2009, we did listening sessions around the state, and we asked caregivers to talk to us about what was their biggest challenges, and even told them to bring solutions to us. They stated exactly what we've talked about here: better wages, benefits, better training, better support. And they talked about respect and recognition. So there you go. It goes right to the heart of the undervalued. And we're still working on those things today. But everything that we built back starting in 2009, that continues to drive our work every single day, because we went out and we did those listening sessions again in 2012 and again in 2014. And actually the pay's only gotten worse. But I would say that even the undervalue and the lack of recognition have gotten even worse. You know, I think our data showed that caregivers were getting paid $10.90 an hour 10 years ago, and they're getting $10.92 an hour today. Or maybe that's reversed. I think it's actually 2 cents less than they were 10 years ago. But I think what you hear over and over, and the way you see people fighting over workers and workers leaving the workforce, tells me that it's the lack of recognition and respect that is the key problem. And then I'll hear my colleagues around the state, around the country also say, you can't just work on one thing at a time. All these things have to come together. And so if we were just to choose wages and benefits, I'm not sure that that would solve the respect and recognition. And I tend to agree with what I've heard from everybody here today too. Jeremy said, if this had been corporations we're talking about with regard to ARPA money, that would have already happened 9 months ago. And they would have gotten it 3 times.
I would like to say something. I kind of wear 3 hats. I'm the mom of a young adult with multiple diagnoses of mental health and autism and medical. I work for the Family Caregiver Navigator Project, and I also have a tiny little business where I train family support partners for the children's mental health system. The biggest problem that I'm seeing, and I used to work for Health and Welfare where I created the program, and the Optum providers, the managed care company here in Idaho, they don't understand the role of a family care support partner. They have them doing things that are not in their scope of work. And then I get people emailing me, Stephanie, can you help me? My supervisor doesn't understand what I'm supposed to be doing. I tell her this, she wants me to do that. And it's extremely frustrating. Their pay, everything you guys have just said about pay, benefits, working 3 jobs, all of it is all there. And I just want to bring up the point that my trainings cost $475 a person. I make less than $8 an hour putting them on. And so obviously I'm not doing that for the money, and then they go out and they make like $16 an hour, but they get no benefits and they have to pay for their own gas and they have to do all these other things. But the agencies and providers, I think, also don't get this. They also don't get, who are these people working for me? Medicaid, I don't think, gets what it is of the self-directed folks who you all are talking about are helping you in your home and your loved ones. But I honestly don't think they get it. And I don't want us to forget that we need to educate the providers that are the agencies and the people paying for these things, even though they're not paying enough. So I just want to throw that out there. Thanks.
Great comment.
I know Marilyn has her hand up, but I don't want to lose this thought. And I think it speaks to Stephanie's point. And when the initial round of funding, which was called CFAC, came out during the first stages of the pandemic, there was money that was to be distributed to provider agencies to get to direct care workers. And I don't think agencies know who these folks are, because when this money was to go out, 25% of folks who provide services who are direct care workers get benefits, right? Medicaid or things like that. And we couldn't even push that money out effectively because it would have disrupted people's benefits. So, the state was like, well, let's just send a couple $1,000s to everybody. Well, that's great, but that couple $1,000s is going to end up pushing people above their limits and could potentially cause them to lose health insurance. So even at that fundamental level, I don't think there's a clear understanding, like you say, Stephanie, of actually what the lived experience is of the people providing this care. And if you don't fundamentally understand what the day-to-day experience is, it's very difficult to see how you can execute policy that addresses the actual issues that they're up against. And so I think what you said is 100% accurate. And we've seen that play out in a lot of different ways, and in particular with the initial wave of funding distribution that was really problematic, and we had to figure out a way to work through it.
on that point, and just to share how like we are, well, I had a provider who was very eager to tell us that she offered hazard pay early in the pandemic to her workers. And there were several who refused to take it, saying that they would lose their Medicaid eligibility if they took it. What I thought was curious is why the agency owner wanted to tell me that. That was sad too. It told me a little bit about, well, does the agency owner understand that? Marilyn, you have your hand up. Thank you.
Thank you, Adrian. Thank you, Jeremy. I just wanted to kind of reiterate that what I have learned in my conversations with the folks in New Mexico and all of you is what we're talking about here are so many different kinds of jobs across so many different silos. They're not called the same thing. They have different labels. And so it makes it very difficult for policymakers to understand all of this. So I think the extent I want to drive home what Jeremy said about us working together and putting together a consistent message for policymakers that explains all of what we've been talking about, because they hold the purse strings. And if we don't convince them, if we're not loud and persistent and compelling, then it's easy for them to ignore us, just like they've done over the last 30 years. So I think that whole, who are direct care workers? They are this, and this. And what's their situation? And when people have used the word crisis, that's an understatement. We're talking about people's lives here. If people don't get the services in their home, not only does it mean they can't go to work or they can't go to the grocery store, it means, as Dana said, they can't get out of bed. And there's no room in assisted living or nursing homes because they can't get staff either. So what this means, this is life and death for people. And policymakers need to hear that message loud and clear. So I just wanted to get on my soapbox for a minute.
Thank you, Marilyn. Who else? Take yourself off mute.
So hi, this is Natalie here. What I tend to notice are small pockets of organized people who we reach our limit and then we push forward and then it all kind of falls apart. And from my observation, I have small pockets of capacity. And I think that is probably this workforce in general, where we find these small pockets of capacity where we can push forward. How do we organize and come together in a way that brings about change and impact?
Yeah, and that's really what I think, Jeremy, probably the action, and as we're working together as agencies are trying to do, is how we can start bringing people in and organizing and creating that consistent message across the board. So we need people to pull into this and spread the message and spread the word. So yeah, Jeremy.
Yeah, that is such a fantastic question, and just strikes at the heart of what probably the most significant challenges that we are going to face. Marilyn and Dana and a number of other folks have been talking this through for several months, and we've been trying to, which is why we engage with Adrian in New Mexico, looking for peers in other states who maybe are a little further down the road and have some experience that they could share. Not just Adrian as an organizer and a leader in that context, but also other direct care workers who have been through this and see themselves empowered as leaders in a different way than we have in the state right now. And we immediately jumped to, I know a couple months ago, we need an association for direct care workers. Like we just need, and I think we were a little bit out ahead of our skis on that. And so we pulled back a little bit, and we're working on a project right now to get funding to conduct some interviews and record stories and to create a place. Our thought right now is it's as simple as maybe a website, but that we can other direct care workers can go to it or see it or listen or watch content so that they can identify with a workforce in a more meaningful way. And we can articulate some shared values and some shared needs in a way that, look, direct care workers are not organizers. They're not politicians. They're not public policy people. They didn't sign up for this, but they need to do it. And so we need to help them understand how to pull what levers, how to communicate, how to talk to lawmakers, how to organize. They've got the voice and the experience, but we need to support them to understand how to navigate this system because it's very complicated and it's very frustrating. We want things to happen quickly. We need them to happen quickly. That's not how it works, right? It's Congress, not progress. And I think we need to start pulling together stories and creating a space where people can identify with an industry and feel like they belong and that they see their people and that they say, good Lord, like that's who I am. That's how I feel. I've never been able to necessarily articulate it that way, but where do I sign up? Like I don't have a lot of time, but I have enough time to send an email or make a phone call. I got a legislator that lives right down the street. I can go bang on their door or take them out to coffee. And right now I think our one of our biggest hurdles is what was mentioned about the diversity of this workforce. And it's hard, it's very Machiavellian and not necessarily in a super intentional way, but we're just all very divided for a number of different reasons. And we need to overcome those barriers. We need to unite. We need a common message, like Marilyn said, and we need workers to feel empowered that, yes, you are valuable. You play an absolutely critical role in this. And we're going to support the hell out of you to get this done. And we need to create that community. And I think out of that and out of those conversations, we'll identify natural leaders who are those people who know their direct workforce community better than we do, who can speak to them in a way that we can't, and who can really step up and with the support of all of us who work in this space all the time, be in a better position to fight for what we need. And so it's not going to be an overnight kind of thing. And we've got work to do to create that community, but the path is there, I think. And Adrian has like shown the light on that path for us. And we need to go down that path together. And I think that's what it's going to take.
Sherry and Natalie, are you able to take yourself off mute and add, because you had some sign me up exclamation points in the chat. What about this is exciting to you, Sherry?
I think for me, just simply that, like I was saying, this is the best breakout session I've ever been into. Like I have never seen people so passionate about all of this. And myself, I'm not only do I have a certified family home, but I am a part of the a management team for a Special Olympics team here. And so we deal with hundreds of people with disabilities on a daily basis, managing the team. And we also deal with direct care staff. And a lot of the things that we're dealing with are, athletes can't make it to practices because they don't have any staff. This has been a long time coming. I've been in this kind of field for 10 plus years, and we just don't have any support. We have been thrown to the wayside, swept under the rug. So to hear people that are like passionate and they have a vision and they have a goal, I'm totally in. So I'm like, sign me up. I will do whatever I need to do. Oh, I can do that too. I don't have a lot of time because, you know, making $2.20 an hour, I have to work many jobs. But again, our population, like Jeremy said many times, is undervalued. They, you know, are just kind of tucked to the side, and we'll just move them over. And, you know, and I think so Marilyn might have mentioned, you know, for 30 years. And I'm like, why is it taking 30 years for there to be change with this? So that's just my 2 cents.
That's more than 2 cents, Sherry. Thank you. Natalie, you were enthusiastic too. What are you going to do?
Yeah, so like I said before, just in my question, there are these pockets of capacity that I have. I care for my 92-year-old grandmother, and then my son who has a profound disability. He's 21, and then I've got 4 other children. And so my life is very busy, but I am passionate, I'm articulate, I have the ability to see change. I want to make change. I want to inspire others to jump on and gather together. But what I see is people like me, we have these pockets. And so aligning and coming together. And I love what Jeremy, you know, you had said, I commented that it was just so brilliant that if there is this, you know, centralized place where we can come together in an identity and then strategize from that position, leaders and people, and somehow simplify or come up with a script or a way to communicate to our lawmakers how important this is. I think that would help a whole lot of us to, you know, take those steps and move forward. And it needs to happen, you know, and not for me as a care provider as much as it needs to happen for the people that I love and I'm taking care of.
Thanks, Natalie. You know, Natalie, you're reminding me of my very first, I think she was our treasurer. And it was real important to her because she was a corrections officer while she was also a caregiver. And we developed this kind of value within our organization that said, our membranes will be permeable. You go away when you need to, you come back. There's not going to be any reason, you know, we don't have dues or anything like that. That's not to say you shouldn't, but, you know, just make it so that it's a welcoming place for when people are ready and have the time to do the work. Thank you, guys. We're coming up close to the end of our time here. Would our panelists like to finish us up with a statement? Maybe even a 1-word statement. How are you feeling at the end of this session?
Just 1 word.
You can do more than that.
Yeah, I think it's just, I love it. Sherry's empowered, and I just think really energized just to be in a room, a Zoom room here with like-minded individuals, but just really just can't say enough around the power of our personal stories and the power of those stories and getting those out, because all people have value, and we need to really ensure that that is being recognized and that people are hearing those stories. And yeah, so just energized, and I thank everybody in this room. So it's been a great morning.
Great. Dana?
Take action now. Join us on March 9th. We need your voice. Take a few minutes out of your time. If you can't do it on March 9th, we'll do it anytime.
Thank you, Dana. And Diana?
Yes, I would say the same thing. Take action today. Thank you to the few people who've taken the time during this session to complete the questionnaire, and keep them coming, because that is a first step to getting connected and getting the support that you may want to have to, you know, make the advocacy actions that we need.
Thank you, guys.